What if I told you that the reason your blood sugar is still not where it should be has nothing to do with your medication, your diet, or your effort, and everything to do with when you drink water? Recent research has demonstrated that drinking water at specific times throughout the day can improve insulin sensitivity by up to 40%, not 4%, 40. The mechanism behind that number is specific and documentable, and by the end of this video, you will understand it completely. More importantly, you will have a protocol you can begin tomorrow morning. Stay with me because the morning timing point I am going to describe is the single change that has produced the most consistent improvement in fasting glucose readings in my practice. And it takes 3 minutes. There is something else I want you to hear before we go any further. The reason this information rarely comes up in a standard physician appointment is not that physicians do not know about hydration. It is that a 15-minute appointment focused on adjusting medications and reviewing lab values does not naturally create space for a conversation about when during the day you are drinking water. The visit is structured around pharmacological intervention. The foundational conditions that pharmacological intervention depends on, like adequate blood volume, efficient transport, and proper cellular hydration, are assumed rather than assessed. This video exists to fill that gap. I'm Dr. Jake Taylor. Write your country in the comments right now, and if you are new here, subscribe and turn on notifications. I make these videos every week for people over 60 who want evidence-based health information they can actually use. Let me tell you about George. He was 68 and came to my practice with a notebook filled with glucose readings that made no sense to him. Same breakfast every morning, steel-cut oats measured precisely, same medication taken at the same time, same 3-mile walk, but his fasting readings ranged from 145 to 185 on different mornings with no apparent pattern. His diet was excellent. His medication timing was perfect. His exercise was consistent. When I asked him to walk me through his morning routine from the moment he woke up, the picture became clear immediately. He woke at 6:30, checked his blood sugar, made coffee, drank his coffee while reading. Then at 7:30, he made his oatmeal and took his medication with a small glass of water. I asked, "When do you drink plain water?" He paused. "When I'm thirsty, I suppose. Sometimes with my pills." He was going from 6:30 a.m. until at least 7:30 before drinking any water. 8 hours of sleep without fluids, then another hour awake without hydrating. 9 hours of progressive dehydration. And his blood sugar was reflecting that dehydration every single morning. We made 3 specific changes to his water timing. 2 weeks later, he called my office. His morning readings had been between 125 and 138 every single day for a week. That consistency had not happened in over 2 years. A month later, his average fasting glucose had dropped by 22 points. No medication changes, no dietary changes. Water, timed correctly. He said, "I thought water was too simple to matter. I cannot argue with the meter." Today, I am going to show you exactly what George changed and why it worked at the biological level. Here is the concept that makes everything else in this video make complete sense. Your blood is a transport system. It carries glucose to cells, carries insulin to receptor sites, and carries the hormonal signals that tell your liver when to release stored glucose and when to stop. When you are well hydrated, that transport system flows efficiently. Insulin reaches cells quickly. Glucose is delivered and cleared. When you are dehydrated, blood volume decreases. The same amount of glucose is now dissolved in less fluid. Concentration rises. Insulin has to travel through thicker, more viscous blood to reach its receptor sites. The delivery slows. Glucose lingers in the bloodstream longer than it should. Think of it as a river delivering packages to houses along its banks. When the river runs full and fast, every package arrives on time. When the river runs low and slow, the current cannot carry the packages far enough. They pile up at the bank instead of reaching their destination. That is your glucose in dehydrated blood. It is not being cleared efficiently, not because your insulin is failing, because the river it needs to travel through has run shallow. And here's the detail that makes this especially significant after 60. Your brain's thirst mechanism becomes measurably less sensitive with age. you can be 2% below optimal hydration, the threshold at which blood sugar elevates by 10 to 15 points, without feeling thirsty at all. No dry mouth, no obvious discomfort, just unexplained glucose readings that do not respond to the dietary and medication changes you have already made. This is why waiting until you are thirsty is one of the most consequential hydration mistakes people over 60 make. The alarm goes off after the problem has already started. There is a second dimension to this that most people never consider. When blood is dehydrated and glucose concentration rises, the kidneys respond by trying to filter the excess glucose out through urine. This process requires water. But if you are already dehydrated, the kidneys cannot operate at full filtration efficiency. The mechanism that should be helping clear excess glucose is itself compromised by the same dehydration that caused the concentration to rise. It becomes self-reinforcing. Dehydration raises glucose. Elevated glucose demands more water for filtration, but the water is not there. Glucose stays elevated longer than it should. This is the cycle that explains why so many people managing blood sugar find that their numbers respond inconsistently to the same meals on different days. On days when they are better hydrated, the transport and filtration systems work more efficiently. On days when hydration is lower, the same meal produces a higher and more prolonged reading. The variable is not the food. It is the fluid environment in which the metabolic process is occurring. Type water. In the comments right now if your daily water intake has ever been an afterthought rather than a deliberate habit. I want to see how many people in this community have been where George was. Now, the 3 timing points that produce the most measurable results. The first timing point is the morning window, and it is the most important one of the day. The moment you wake up, before coffee, before breakfast, before anything else, drink 1 full glass of warm water. Approximately 350 milliliters. Add a small pinch of natural sea salt, just what fits on the tip of a butter knife, and the juice of half a lemon. The temperature matters. Warm water, not cold, keeps blood vessels relaxed and dilated, allowing insulin to circulate more efficiently through the vascular system from the first minutes of your day. The sea salt matters. After 8 hours of sleep, you have lost electrolytes through normal overnight processes. Those electrolytes, specifically sodium, potassium, and magnesium, are what allow your cells to actually absorb and use the water you drink rather than passing it through. Without them, you can drink water and still not effectively hydrate at the cellular level. The lemon matters. The organic acids in fresh lemon juice slow the early morning glucose release that occurs when your adrenal glands produce their morning cortisol peak. Cortisol tells your liver to release stored glucose. Proper hydration with the right mineral balance and organic acids at waking dampens that response. This combination addresses the cortisol-driven morning glucose spike, the dehydration that accumulated overnight, and the mineral deficit that prevents cellular water absorption. 3 mechanisms addressed in 3 minutes. One thing worth understanding about why cold water specifically undermines this protocol. When you drink cold water, blood vessels near the digestive tract constrict reflexively. Constricted vessels mean slower blood flow. Slower blood flow means insulin circulates less efficiently to peripheral tissues. The effect is most pronounced in the morning, when your cardiovascular system is transitioning from its overnight low activity state, and the first fluids you consume set the tone for that transition. Cold water tells your vessels to tighten. Warm water tells them to stay open. In the context of insulin delivery, that difference matters from the first minutes of your day. Let me tell you about Dorothy. She was 72, and her most persistent frustration was her fasting morning glucose. She would eat a careful dinner, check her blood sugar before bed at an acceptable level, and wake up to a reading 30 to 40 points higher. Her physician called it the dawn phenomenon. Cortisol spike, liver glucose release, nothing to be done. We added the morning water protocol. 3 weeks later, her average morning reading had dropped from 168 to 131. The dawn phenomenon had not disappeared, but the dehydration component that was amplifying it had been removed, and the difference was visible in her numbers every single morning. She said, "I was told this was just what happens. Nobody mentioned that I was waking up dehydrated and making it worse. The second timing point is the pre-meal window. 15 minutes before lunch and 15 minutes before dinner, drink a glass of water at room temperature, approximately 200 milliliters, not with the meal, before it. This serves two distinct purposes. First, it prepares your digestive system, stimulating enzyme production and establishing the fluid environment in which your intestine processes carbohydrates. Second, it slightly dilutes stomach contents as the meal arrives, slowing the rate at which carbohydrates are absorbed into the bloodstream. When glucose enters the bloodstream more gradually, your available insulin can keep pace. The spike is moderated before it builds. Clinical studies have demonstrated this simple habit can reduce post-meal glucose spikes by up to 20%. For someone managing blood sugar, that is often the difference between a 2-hour reading that is acceptable and one that requires corrective action. The common mistake here is drinking water with the meal or immediately after. The timing window of 15 minutes before is when the mechanism is most effective. With the meal, water dilutes digestive enzymes and reduces the pre-meal preparation effect. After the meal, the absorption process has already begun. There is a secondary benefit of the pre-meal water timing that connects to appetite regulation. When the stomach contains water before a meal, stretch receptors in the stomach wall send satiety signals to the brain before food arrives. This means you feel satisfied with a smaller amount of food, which reduces the total glucose load of the meal. Research has found that pre-meal water consumption reduces meal size by a measurable amount in people who practice it consistently, which has a compounding effect on post-meal glucose management over time. Smaller glucose load combined with slower absorption produces a significantly moderated post-meal spike compared to either benefit alone. Margaret was 69 and had been managing type 2 diabetes for 6 years. Her post-meal readings were her most frustrating variable. She ate carefully, but 2 hours after lunch, she was consistently seeing readings in the 190s. When we added the pre-meal water 15 minutes before lunch and dinner, her 2-hour readings dropped to the 150s to 160s within 2 weeks. Same meals, same medication. 15 minutes of timing made the difference. She told me I was drinking water just at the wrong time. The third timing point is during physical activity. For any sustained activity lasting more than 20 minutes, walking, gardening, housework, drink approximately 100 milliliters every 15 minutes during the activity, small consistent sips, not large amounts at once. Your body can absorb approximately 200 to 250 milliliters every 15 minutes. Anything beyond that volume passes through without meaningful cellular hydration. The analogy that helps patients understand this: watering a plant by pouring an entire bucket at once causes most of the water to run off the surface. The roots stay dry. Slow, steady watering allows the soil to absorb it progressively. Your cellular hydration works the same way. During physical activity, blood glucose fluctuates in response to muscle demands for energy and to the hormonal signals exercise generates. Consistent hydration during activity keeps blood volume stable and prevents the unpredictable swings that commonly follow exercise in people managing blood sugar. Helen was 67 and had been walking 30 minutes every morning for 2 years as part of her blood sugar management. She had noticed a pattern that confused her. Some mornings her post-walk reading was lower than her pre-walk reading as expected. Other mornings it was higher. She could not identify what was different on the days when exercise seemed to raise rather than lower her glucose. When I asked about her hydration during her walks, she never drank water during a 30-minute walk. It felt unnecessary for such a short time. On mornings when she started the walk already slightly dehydrated, the exercise-induced stress hormones, which are released during any physical exertion, combined with low blood volume to push glucose up rather than down. When we added a small water bottle, she sipped from every 15 minutes during her walk. The post-walk spike pattern disappeared almost entirely. Her walk reliably lowered her glucose the way it was supposed to. She told me, "I thought exercise always helped. I did not know I was sometimes doing it in a way that worked against me." Before I get to the final piece of this protocol, I want to stop for a moment. If this is explaining the mechanism behind something you have been experiencing without understanding it, subscribe right now. We publish every week, and this is exactly what this channel is for. 3 seconds. Subscribe and let's finish this. Now, the evening edition that addresses what happens to blood sugar overnight. 1 hour before bed, drink a glass of warm water with 200 milligrams of magnesium citrate or magnesium glycinate dissolved into it. Not magnesium oxide, which has poor absorption, citrate or glycinate specifically. Magnesium is directly required for insulin receptor function at the cellular level. Without adequate magnesium, insulin receptors cannot bind properly even when insulin is present. Research suggests that up to 70% of adults over 60 have magnesium intakes below the recommended level. Many are clinically deficient without knowing it. Taking magnesium before sleep addresses 2 problems simultaneously. It improves overnight insulin receptor sensitivity, contributing to more stable fasting readings in the morning, and it supports deeper, more restorative sleep by relaxing the nervous system, which itself reduces the cortisol-driven glucose release that worsens fasting numbers. The sleep connection deserves more attention than it typically receives in conversations about blood sugar management. During the deep sleep stages that magnesium supports, growth hormone is released. Growth hormone plays a direct role in maintaining insulin sensitivity. When deep sleep is shortened or disrupted, growth hormone release is reduced, insulin sensitivity decreases, and morning fasting glucose tends to be higher than it would be after truly restorative sleep. Addressing sleep quality through magnesium is therefore not only a direct insulin receptor effect, it is also an indirect improvement in the hormonal environment that determines your fasting glucose before you take the first step out of bed. William was 71 and described his sleep as shallow and unrestorative for years. He woke multiple times at night, never felt genuinely rested, and his morning glucose was consistently in the 160s to 180s despite medication and careful eating. The magnesium glycinate protocol 1 hour before bed changed both problems simultaneously. Within 10 days, his sleep was measurably deeper by his own report. Within 3 weeks, his average fasting glucose had dropped to the 140s. His wife noticed the change before he consciously registered it. She told him he was sleeping differently. He told me, "I had 2 problems I thought were separate. They were connected the whole time." Robert was 74, and his most frustrating pattern was waking with glucose readings that seemed entirely unrelated to what he had eaten the previous day. His dinner was careful. His bedtime reading was acceptable, but he consistently woke with elevated fasting numbers. When we added the magnesium water protocol 1 hour before bed, his average fasting glucose dropped 11 points over 4 weeks. His sleep quality improved noticeably within the first week. He told me, "I had been fighting my morning numbers for 3 years. The problem was happening while I slept, and nobody had suggested addressing it at that time. Here is your complete daily protocol starting tomorrow. Upon waking, before anything else, 1 glass of warm water, small pinch of sea salt, juice of half a lemon, 350 milliliters. Drink it in the first 10 minutes of your day. 15 minutes before lunch, 1 glass of room temperature water, 200 milliliters. 15 minutes before dinner, 1 glass of room temperature water, 200 milliliters. During any physical activity over 20 minutes, 100 milliliters every 15 minutes, small sips. 1 hour before bed, 1 glass of warm water with 200 milligrams of magnesium citrate or glycinate. Total daily water intake. Your body weight in pounds divided by 2 gives you your daily target in ounces. A 160-pound person needs approximately 80 ounces daily, about 10 cups, spread across the day in consistent sips rather than large amounts at once. How to know if you are hitting the right level. Your urine should be pale yellow throughout the day. Clear means overhydrated. Dark yellow or amber means dehydrated. Pale yellow is the target. The timeline of what to expect. Within 3 to 5 days, morning readings begin to stabilize. The overnight dehydration component that was amplifying your fasting glucose is addressed from day 1. Within 2 weeks, Post-meal readings typically show measurable improvement as the pre-meal hydration protocol takes effect. Within 4 to 6 weeks, the cumulative effect of consistent daily hydration and nightly magnesium begins to show in the metabolic patterns your physician measures at appointments. One practical note about the first week. When you increase water intake significantly, you will likely find yourself visiting the bathroom more frequently than usual. This is normal and expected. Your body is adjusting to a new hydration baseline. Most people find this settles considerably by the end of week 2 as the kidneys calibrate to the new consistent intake. Do not let the first week of adjustment discourage you from continuing. The adjustment is temporary. The metabolic benefit is ongoing. A note on limitations that I want to be direct about. This protocol supports blood sugar management. It does not replace medication, dietary changes, or medical care. If you are on blood pressure medication, increasing hydration can lower blood pressure further as fluid volume increases and vessel tone normalizes. Monitor for dizziness and discuss any changes with your physician. If you have kidney disease, speak with your physician before substantially changing your water intake, as the kidney's filtration capacity may require individualized guidance. What this protocol does is remove a barrier that undermines the effectiveness of everything else you are already doing. Your medication assumes your blood is flowing at adequate volume. Your diet work assumes your metabolic transport system is operating efficiently. Your exercise assumes your stress hormone response is not being amplified by dehydration. When hydration is optimized and timed correctly, every other part of your management plan has a better foundation to work from. Patricia was 70 and came to my practice after 2 years of frustration. She was on 3 diabetes medications. Her diet was excellent. She exercised regularly. Her physician was running out of adjustments to suggest. When I reviewed her daily habits in detail, her water intake was 3 to 4 small glasses daily. Coffee in the morning, tea in the afternoon, and water only when she specifically thought about it. We changed nothing about her diet, her medication, or her exercise. We changed only when and how she drank water. 6 weeks later, her A1C had dropped from 8.1 to 7.4. Her physician was puzzled. He asked what had changed. When she told him, he sat quietly for a moment and then said, "I should have asked about this 2 years ago." She told me, "I spent 2 years thinking my body was failing me. It just needed water at the right time." You are not broken. Your medication is not failing. Your effort is not wasted. What has been missing is a foundational condition your metabolic system requires to function at the level your treatment plan assumes it is functioning. Water, timed correctly with the right additions, restores that foundation. And restoring that foundation costs nothing except the decision to begin tomorrow morning. Tell me in the comments, which of these 3 timing points are you going to start with tomorrow, and how much water do you actually drink on a typical day right now? Be honest with yourself when you answer that second question. Most people I ask this to discover they are significantly below what their metabolism requires. Write your answer below and tell me what country you are watching from. I read every comment, and the patterns I see in your answers directly shape what I cover in future videos. If this video gave you an explanation for something you have been experiencing without understanding, share it right now with someone who is managing their blood sugar carefully, doing everything their physician recommended, and still wondering why the numbers are not responding the way they should. Someone who has been told their management plan is correct, but whose readings are still unpredictable. That person needs this information today, and sharing it costs you 30 seconds. I'm Dr. Jake Taylor. Subscribe if you have not already. Take care of yourself, and I will see you in the next video.